You're welcome here. This is Dr. Abimbola Onifade, and this presentation is on Smart Medical Premium Program. And this is an intensive program targeted at reversing diabetes and hypertension. Now, I have some crucial questions to ask you before we progress. And the first one is, how many medications are you taking now compared to when you were first diagnosed? Especially if you have been diagnosed for quite some time, 1 year, 2 years, or many more years than that now. You discover that at the initial diagnosis, you probably was not even placed on any medication, or possibly you're just placed on one medication. Before you know it, your medications begin to increase. And even though you might be using one or two medications now, some medications are combined. So how many times have your medication been changed? And how many medications are you taking now compared to when you were first diagnosed? Also, do you think you are getting better if you keep needing more medications and your parameters keep fluctuating? So that's what people experience. Even though you are on high dose of medications, your parameters are still not doing well. So do you think you are getting better? Your medication keeps increasing, your parameters keep fluctuating. Even if your parameters are getting better, but you keep on needing more medication, do you think you are getting better for that? Now, let's go to some real questions again. Are you okay with complications of diabetes and hypertension? Because this program might not be for everybody. If you are okay with the complications of diabetes and hypertension, you don't mind. Possibly some people even like visits to, it makes them feel like they are monk when they go to hospital. My friends are sick, then they want to fall sick as well to show that they go to expensive hospital and the rest. So, but answer this question by yourself. As a person, are you okay with the complications of diabetes, hypertension? Talk about stroke, heart failure, kidney problem. Talk about nerve problems and neuropathy, that's nerve problem, and so many other medical. Diabetes virtually affects every aspect of your body, and hypertension is notorious. It causes a lot of problem as well. Stroke, heart failure, and diabetes and hypertension cause similar problems anyway. So are you okay with the complications of diabetes and hypertension? Are you okay with shortened life expectancy? Because once you have diabetes and hypertension, the life expectancy becomes shortened automatically. That's not your portion. And also, are you okay with side effects of drug? This is just a common thing. And again, are you okay with expensive drugs and supplements? If your answer to any of the above questions is no, then this program will be of immense help to you. So long as, even if only one of those questions, if your answer is no, this program will help you immensely. Now, do you hate sleeplessness and pain? Because this is what most people with diabetes and hypertension complain of always. Sleeplessness and pain. Do you hate it? And again, do you hate feeling unwell? You just feel you are not okay. You can't really point at it that you are feeling healthy within yourself. Do you hate this feeling? Do you hate being out of shape? I want to be proud of your look. Also, do you want a state of health that can carry you to the future of your dream? Now, if your answer to any of the questions above is yes, then you need to jump into the premium program right away. Now, let's go through few feedbacks from people on the premium program before I give you more information. Let's consider the feedback of Mr. TU. Just for privacy reason, I have to use this abbreviation. So this is a feedback from Mr. TU. Thanks so much, doctor, for your wonderful assistance, which you have ingeniously provided through the meal plan. It is working effectively, I must confess. My fasting blood sugar, which had remained 103 to 112, has come down to 88 on the count. Now, the fasting blood sugar came down to 103 to 112 on the program from what is usually higher than this. Then again, going on in the program, the fasting blood sugar came down again because more instructions were given, and that's what this man is talking about here. Then Mr. Hoho said, My BP was 143/90 and my weight was 81.2, but now it's 117/70 and 69.8. Then Mr. Hehe: good morning, doctor. I'm glad to tell you that my BP is now 118/78 to 120/80. My feet are no longer swollen. I was on 2 BP drugs before, but it's been reduced to 1. Thank God and thank you, sir. Now we'll consider more during this presentation. Now, what we deal with in the premium program includes diabetes and hypertension, and weight loss. If you have any of these 3 problems, you are in the right place. Even if all you have is just one, you are also in the right place. And I'm giving you a bonus. I'll be giving you a tip which deals with what you need to know about food that naturally prevents or lowers high blood cholesterol without the need for statin. Statin is a drug that you use to lower blood cholesterol, and then it's highly unreasonable and it has so many side effects. If you can achieve this naturally, it is highly unreasonable to depend on statin. And you'll know more about that in this program, and then that will blow your mind, and that will definitely help you. I have no doubt about that. So consider this: diabetes and hypertension, weight loss, and if you're struggling with high blood cholesterol, then coming into this program means you're in the right company. Now, highlight of the program includes, the main highlight is meal plan. Now, don't get it wrong. This is not just a program for where we just talk about meal plan. Only meal plan will not solve your problem. But meal plan is very important, because one of the most crucial things we are changing on this program is the meal that you eat. This is diabetes and hypertension intervention program, and a large percentage of it is dietary. We're talking about lifestyle modification as well as for instance the exercise and some other lifestyle modification. But one major highlight is the meal plan, and then we'll be talking about detailed meal that provide varieties of food groups to choose from. Either you're in Nigeria or any part of Africa, or you're even in the Western world, we have detailed meal plan that caters for whichever part of the world you are into, and then that will help you to choose from whatever your preference of food is. Then we'll be talking about best fruits for you, then how you can understand different types of food and how it can impact your blood sugar and blood pressure. You will know the best food to eat and the food to limit. Now, consider this testimony of one of the participants. Good evening, doctor. Thanks indeed for so far. I started the 1-month feeding program on the 27th of May. Do I have to complete the 1 month before I attempt this latest one for 2 weeks? I have observed remarkable improvement in my blood sugar. I am waiting to be better. Happy Sunday. Now, what this person is talking about really, after the 1 month, I usually give guidelines that you need to follow. So this is the question, and the important thing about this is that this person has seen remarkable improvement. Then we'll be talking about lectures and support on how to get off medication safely and sustain improvement. You will have received help regarding this. Then you have access to professional support. I'll give you free support for joining this program, and answer to questions from professionals, lecture on how to get the best out of exercise, just like I told you before, lectures on other aspects of health and how to achieve and sustain good health naturally. You need all of this, and the goal is to get off medications, to get your parameters to normal range without medication, and you need to understand how this works. This is not a quick fix like I've been saying, but once you change your diet and once you change your lifestyle, as you'll be doing on the program, your body will, that means you'll be giving your body the natural, the right condition, and you'll see how your body can heal naturally just by changing up, because this is what is causing the problem. Every medical organization anywhere in the world know this. There is only an apathy to accept, but you don't need to wait for any organization for you to get your own health back. Then the goal also is to have a sustained improvement and have more energy, mental focus, and clarity. So these are the goals, but you must be ready to be patient, and you definitely achieve this, because all those who have been on a program are achieving this. But this is not a quick fix. I'm giving you a special offer and you have to take this chance at once. I'm giving out a discount to encourage you to join, and that's why the program is for what it goes for presently. So how much does your health worth to you? And the duration of the program, actually the duration of the program is lifetime. You are going to learn principles you need to apply to your life for the rest of your life. You are going to learn food that will help you, and we are going to practicalize this by having a meal plan. Then for 1 month, I will be with you, myself and other members of our team will be with you to support you. You have questions, so that's why I'll say the duration of the program is for 1 month. Then there's optional retreat after the program. So after the 1 month program, there's optional retreat, optional health retreat, because some people after that they feel like they need more support. They still want to be able to achieve some other things. So you can always be part of our health retreat, which is optional. Now the cost will increase at any time, and the bonus will be removed at any time. So that's why you need to join immediately. Cost will increase at any time, and the bonus will be removed at any time. So visit www.smartmedicalprograms.com/premium for more details on how you can make payment, or get more details from the description link if you are watching this on YouTube. And don't walk past this program. This is a warning for you, because it will save your life. Then let's quickly talk about few more testimonies now. Mrs. Otis says the results are obvious. And what I notice is that anytime I miss the plan for about 2 consecutive times, I notice a slight change too. So it really makes it logical and reassuring that as I adhere, I make more progress. Thanks, Doc. Seeing the seemingly impossible become possible is a big relief. Doctor, I sincerely thank you for bringing up this program. That's from Mr. Hohe. Since I started the meal plan, I've experienced tremendous improvement on my sugar level. For instance, from the usual fasting sugar of 150 to 180, it has dropped to 81 to 98 always, though it requires self-discipline. Thank you so much, Doctor. God bless you. Mr. T says, thanks so much, Doctor, for your wonderful assistance, which you have ingeniously provided through the meal plan. It's working effectively, I must confess. My fasting blood sugar, which had remained between 103 to 112, has come down to 88 on the count. So if you want to learn more about this, you want to read more testimony, join our Facebook group. Join us on Facebook. We have a group, a community dedicated to this. You'll see lists and loads of testimonies of people who have followed the program. You get the link to join from the description box. If you are watching on YouTube, if you're watching on this on our website, of course the link is there as well. So join now and take your health back. Join this premium program. It will save your life. Now, if you see anybody that says takes this program, just read through the website, click on it, and join this program. Thank you.